Hi, I'm Dr. Danielle Groves with Pascack Valley Medical Group. Some of you may recognize me from the talk I did not too long ago on low back pain or the talk that I did on joint pain. Today, I'm going to be talking to you about something a little bit different, and some of you may not even know the term, but I'm going to go over it. It's called ergonomics. So ergonomics is really the study of how we use our bodies in the most efficient manner. So a lot of different types of companies use ergonomic studies to help improve the efficiency of their employees, but also we use ergonomics to help protect our body and keep ourselves moving in a safe and effective way. So ergonomics, for example, in a workplace such as this, I can describe. So if you happen to have a job where you're working wrapping gifts at a high-end department store and your coworker is standing next to you and they have a workstation right here and they're wrapping their gifts at this waist level, and you are given a workstation where your shelf that you're wrapping the gifts on is up here, and you need to reach in order to wrap your gifts and lift your head and neck and shoulders up like that, you most likely are at what we would call an ergonomic disadvantage. And that is an ergonomically unsound workplace that would most likely lead to a lot of stress on the shoulders, neck, maybe the back, and also make your output be probably less than your coworkers who's getting the workplace atmosphere that is at waist level. So when we talk about ergonomics, we could talk about manufacturing ergonomics, we could talk about all different types of things, but today I'm going to talk to you guys about something that probably hits home for many of you, and that is office-based ergonomics. So if I had this talk in 2018, it might look a little bit different than it does now. So now the office has a whole new meaning. So you may be going into New York City and going into your office building to your regular work environment, but a lot of us are not. And many of you are working in what we now call the home office. And the home office could actually be a true home office, but for many of you it's not. For many of you it's the dining room table, it's your bed, it's your couch, it's a stool that you have that you might be able to sit on, and it's not always so great for your body the way that you're positioning yourself. And I have to say that over the past year, I've gotten so many patients coming in saying that they have different types of complaints, back, neck, knee, hip, and they think it's related to the way that they're sitting during their job. So today, I just want to give a little information, explain safer type postures and workstations that you could even set up at home to help reduce the stress on your joints, your neck, and your back. I'm going to start from the bottom down because pretty much ergonomics affects our whole body, and our workplace can affect our whole body. So in our regular workplace, we might be getting up and going over to our colleagues' desks. We may be going to a conference room to have a big meeting, and we're up and about and we're walking around quite a bit. In the home office, we might be sitting for hours and hours on end. And at first, in the beginning of the pandemic, maybe it was a little bit haphazard as to what we were doing at home, but now that we're locked in the workplace at home, we might be sitting for hours trying to accommodate the demands of our employers. So what I'm going to start with is really the bottom half of our body and how we can accommodate it in a good sitting position to reduce the stress on our knees, hips, and low back. And then I'm going to work my way up to the upper body, which has its whole host of problems related to the desk-type workplace. So one rule of thumb is that everything related to the lower body does best when it's at approximately a 90-degree angle. So 90-degree angle, we're just talking about a right angle. So pretty much everything should be in this shape to provide the most amount of support. So if I have a chair, I'm going to sit down now. And I want to have some stability and support. The ideal would be that my feet are touching the ground. So I'm short, and it's sometimes difficult. My feet don't always touch the ground when I'm seated at a desk, and that puts a lot of undue stress on my low back. So for you who are at home and maybe don't have an adjustable chair, sometimes it's helpful to put a big book, encyclopedia or something like that underneath your feet so that you can have something to rest your feet on. And again, your ankle and feet should be just at a right angle with the ground so that you have good support. Working our way up from the ankle, we get to our knees. So That's another issue if you're short or if you're very tall, because a lot of chairs have different depths. So the depth of the chair can play a role in how your knees hang and how they're supported. So in this particular chair, I can fit quite well, and my knees actually are at a right angle. So they're just at the perfect position to not put stress on my back. If I'm to sit forward into the chair like this, all of a sudden my knees go at a more acute angle, and I can put a lot of stress on the front of my knees. So in this chair, it's best if I'm seated all the way back. The one thing that you may notice is if I'm seating all the way back, my hips automatically are at a right angle. So this puts a lot less stress on my hips. That all sounds great. Also, I get to use the backrest to support my low back. So this is actually an ideal position for support. However, now we're going to put a little bit of a workstation in front of me. So let's say this is my dining room table or some type of desk. All of a sudden this is here, and this may change the game a bit. So instead of being at my good right angle, perhaps my laptop is all the way forward, and now I'm going to do this. So now again my hips are no longer at a 90-degree angle, and there's a lot of stress across the hips. Also, it's putting pressure on my knees and on my feet and ankles to be in this position, and obviously stress across my low back. So sometimes we need to look at where we're putting our computers, our laptops, and all of our devices to make sure that although our seat may be fitting us well, that we're actually getting the true benefit out of it. So just as I was getting ready to give this presentation, I started to look at my own workstation, and I realized it's an ergonomic nightmare. And some of the things that I'm doing in my own setting are totally wrong. I have my winter coat sometimes shoved behind my back. Sometimes I put my handbag behind my back on my chair, and it forces me to just sit like on the edge of my seat and to lean forward like this. That is terrible ergonomically and leads to a lot of pain usually in the hips and back, which I've been having, and now I kind of refreshed my memory about good office ergonomics and made some changes. So hopefully you guys can too. So the thing about the hips is they're very, very powerful joints. They're a ball and socket joint. So it's a ball like this and a socket. And when you go to a doctor with hip pain, what do? We flex the hip and we check it, because hip flexion, if there's some arthritis, usually causes some pain. What we see is that if you're sitting in flexion for a long period of time, it also starts to make that joint gel. And if any of you remember the talk I did about joint pain, you'll know that if you're in a position for too long and you have some mild arthritis, the joint can get very stiff and tight and kind of get gooey and thick, and we call it gelling. So if you're sitting in a position with your hip very flexed for a long period of time, like your work day, and then you go to stand, you're going to have hip pain and it's going to feel very stiff. If the hip stays at a more of a right angle, this is less likely to happen. The other thing is we have a very large muscle that attaches to our lower back and comes down into our hip and attaches to our thigh bone. That's the muscle that lifts our leg like this. It's called the iliopsoas. That muscle likes to get short. And so when we're sitting at a desk for a long period of time, that muscle is definitely short and its tendon attachment gets short and tight. So then when we go to stand up and straighten back up again, we can get a lot of anterior hip pain. So if you're experiencing that, I do recommend that you get up throughout your workday, stretch, take a little walk, even if it's just around your workstation, to stretch out the hip joint a bit. Next, I'm going to talk about the low back. So the low back, it gets support from the backrest, but some people, especially females more than males, have what we call a lordotic back. So their back is arched a little bit. If that's the case, the backrest may never actually even touch their back, and they should use a lumbar support pillow, which is a pillow that curves a little bit to give some support when leaning back. If you have a flat back and the back is more straight, then usually a traditional backrest will be just fine. This is not an ideal chair because it's not providing any support for my upper back. The chair hopefully could come up to the height of the shoulders to provide a little bit more support. When we look at the rest of this chair, other things that are wrong is that the armrests are too low for me. So naturally, if you're going to use the armrests, I would have to hunch forward like this. That is not a good position for the back, upper or lower. And it also starts to affect the neck because then I'm looking like this to see my laptop. If the armrests are too high, you end up in this position. And that can lead to a lot of pressure and stress on the shoulders. So we want our armrests to be at a natural position when the arms are hanging low. So an adjustable armrest is ideal, but sometimes we understand not reality. One other thing to keep in mind is that if you are doing a lot of work, let's say on a chair like this, and you're having conference calls and you're leaning on your elbow on the armrest, you need to use caution, because there's a nerve that sits right here behind the elbow called the ulnar nerve, and it's trapped between two bones and sits really close to the surface. So if you're having, let's say, a 1-hour conference call and leaning like this, you could be putting pressure on that nerve without you even knowing it. You would get tingling and numbness sometimes in these two fingers, your pinky and ring finger. You could get weakness in the hand and start to develop even some loss of fine motor control and grip strength. And it could be from recurrently doing this. And a lot of people have behaviors. We just do things all the time the same. So you're looking at your screen, you're on a video Zoom call, and you tend to lean like this, and you're constantly putting pressure on that nerve. You really need to look at that. We call this nerve hygiene, and be good to your nerves and make sure you're not putting that kind of pressure again and again, because it can start to cause real damage that might end up being irreversible. So take a look now, see if you can help it. Same thing if you're leaning with your elbows on the desk, you can get the same type of problem. So now moving up towards the neck and shoulder area, there are so many issues ergonomically that relate to the neck and shoulder. So first off, I'll just say that if you talk, I'm sure, to any chiropractor, orthopedist, physical therapist, or physiatrist, we'll all tell you the same thing, is that years ago, so when I was in residency about 20 years ago, we talked about a thing called head forward posture all the time. It was usually a problem of the aged population. So the neck starts to fall forward, sometimes a little bit of what we call kyphosis, rounding of the shoulders, and a little forward posture, and the head ends up here. And sometimes the head ends up like this. Well, one thing is that it's no longer a problem of the aged population. We're starting to see this in really young people. And the problem is that the neck is designed to be in a little bit of a curve back like this. We call that the natural cervical lordosis. So unfortunately, what we're seeing is what we call reverse of the lordosis, which is a curve in the other direction. So the neck is now starting to come like this. And I'm seeing 20-year-olds come in with neck pain, and we're getting x-rays, and we're seeing that their bones are actually starting to change the shape and form this shape. Once the bones start to change shape and go in that direction, that can't be really changed. We can strengthen, we can condition, we could do a lot with the muscles, but we're seeing all this bony change. Why do I think this is happening? I'm sure most of you can probably figure this out, but we have a thing in our lives that we didn't have before, our cell phone. So pretty much we have people that are, I mean, all of us are doing it. I do it all day long. I look down, I get a text message for everything that I do on the computer. I get a security code, I have to look down. And then I go home at night and I just like anybody else want to see what's going on Facebook. And so I look down, and again, my neck is in this position. Then I go to my computer, I go back to my phone, and our necks are in this position. And our teens, who are, I'm sure, not on right now watching this, are doing it all the time, right? They're Snapchatting, they're TikToking, whatever they're doing, and their head and neck is in this position. They walk through the halls, they're like this. They walk down the stairs, they're like this. And it's starting to take its toll on the neck. It's a really big issue because not only does it just change our posture and make us not look good, it puts a huge amount of stress on the muscles that are here. And I have a freakishly long neck, so you could take a look and see. So if I'm like this in the normal neck position with earlobes over my shoulders, as it should be, my neck is in a good position and solid and sound ergonomically. If all of a sudden I look down at my cell phone, you can see the neck changes dramatic shape. Now I lean forward over my workstation and I'm doing this, and my head starts to fall forward. So this is even more significant than just the muscle strain. Inside, we have our bones. We've talked about this before in the spine lecture that I did a few weeks ago. They're stacked on top of each other with discs and a hole for the spinal canal. So our spinal canal, we should be able to kind of see through. But when we start to slip these bones one forward on the other, all of a sudden we can't really see through it anymore. And the spinal cord is what sits in there. So we don't really want that position to occur for long periods of time. We don't want our bones to change shape and fall forward because we want the hole for our spinal cord to stay as big as humanly possible because we want that cord to have a lot of room. We want those nerves to have a lot of room. We want them to be able to control our walking and control our arm movement and to control our sensation. So it's really important that we start looking at our neck posture and start working on different ways. So something I just recently got is this handy little device here just to hold my cell phone. There's even taller ones that holds it more up at eye level because our ideal for neck motion would be, if we're at a workstation, is that our head is looking straight ahead. So if you look at your laptop and you realize you're down most of the time like this, propping it up might be helpful because then you could look a little bit more straightforward. Sometimes also leaning your screen back helps a little bit, and you could work with your arms in a comfortable position, kind of look forward, use your head up and down and side to side, but not have repetitive stress. When I looked at my workstation, I realized my laptop is too far away. It's causing me to lean forward, reach for my mouse. That's not good for my neck, shoulder, or arm. And my monitor is kind of like this on a total angle. So I'm doing this a lot of the day, looking at the monitor, which is really not great either. So I recently moved my monitor more in front of me so I could take a look, move the laptop and the keyboard closer, and push my chair a little bit more underneath the desk so I could get the support of the backrest. And it's made a big difference. Hopefully you guys can do something similar at home too. Holding the cell phone up like this just helps because at least if you get a text or you get a notification, you can kind of see it and you don't have to, again, look down, pick it up from your desk and look down to check it. One thing that I would recommend if you are working in a system like this is that throughout the day you take a few moments to pull your shoulders back together. So pull your shoulder blades together just to get a little bit of the stress out of the shoulder blades. Then there's something else that you can do. And we call them like ugly chin tucks. So you pretty much tuck your chin in as deep and as far as you can until it becomes super ugly and stretch out those neck muscles. So when you're tucking your chin in, it stretches those neck muscles out. And then throughout the day, if you bring your shoulder blades together a few times, you'll notice a reduction in the stress of the muscles up here, which might help. Sometimes it helps too at the end of the day or during your work day if you could do a few slow neck extensions to help kind of encourage that curve to come back to its normal self. That could be helpful as well. A few other things that you can do throughout the day is to get up, walk around, do some stretches. Sometimes I recommend that people go into the doorway and just put their arms in and stretch out the chest wall, because from being kind of everything in front all the time, we get really tight in our pecs, and then we don't take deep breaths in, and we kind of get a lot of tension in here, which leads to tension back here. Also, recurrent stress on the neck leads to chronic headaches and problems with sleep as well. So we want to try to fix that and nip it in the bud, so to speak. People ask me a lot about stand-up desks. It's a great thing. So it would be great to sit for part of your day, and then if you could go up and have like a Veridesk type situation where the desk lifts and you could stand for a part of your day, that helps as well. It's all about not putting yourself in a position that is disadvantageous. So just like we talked about the person who's wrapping the gifts and trying to wrap them above their head, that's not ideal. It's also not ideal if your computer and your laptop and everything is way in front of you and you're reaching and you can't reach anything comfortably and your mouse is over here and your telephone is over here. That's going to all lead to poor posture. It's going to flex your hips again to that bad, steeper than 90-degree angle and put a lot of stress on your back and the rest of your joints. So I'm going to open this up for some questions now. I went over a lot of things and
could you go over again, are there any exercises or treatments you would recommend for those who work from home or from an office that experience this kind of pain?
So I would recommend that at least you stand up a few times in your day. You do some general stretches. It doesn't have to be complex. You don't have to go through an entire exercise routine in the middle of your workday. No one expects that. But honestly, just standing up and reaching to the sky a few times a day helps lengthen your spine and take some of the stress off of your spine and your neck. Lying on your floor on your belly and pretending you're like a Superman and just kind of stretching your body out. Sometimes if you can do it in a little bit more complex way, if you lift your left arm and your right leg while you're laying on your belly and extend back, and then do the opposite, it stretches everything in the opposite position that you've just been sitting for all those hours. So it's such a simple thing to do, and you don't have to do it for a long period of time, but just get down there on your rug, lie on your belly, reach your arms out, and start to stretch a little bit. You should feel a good relief in your chest wall and a good relief in the lower abdomen and in your hip joints. And then, as I explained, a really great thing is just take your shoulder blades and squeeze them together and hold it for a few minutes. You'll notice right away a lot of release in the tension of your neck. And I think those things are really helpful just to get going.
Is there any specific chair you recommend?
So I don't recommend one chair for everybody. I've tried many, and some that have like the most lumbar support are terrible for me, and they may be great for somebody else. Also, your size really matters. So if you're 6'4" and I'm 5'2", we're clearly not going to fit well in the same chair. So those are things you need to take into account. You should be able to get your butt back in the chair so that your back can reach and your hips can be at 90 degrees. And then if you're very small and the seat base is too far, it's going to be hitting you behind your knees and pushing your legs out. So sometimes that can be an issue that you need to take into account. Sometimes there's nothing you can do. The chair you're in is the chair you've got. And so if you are short like me, sometimes it does help to put a lumbar support or even just a regular pillow behind to inch you forward so the chair's not hitting you so deep behind your knees and making your legs kind of stick out in front. If you're a very tall person and you're in a chair that's too short and too low to the ground, obviously your hips are going to flex more, your knees are going to bend more, and that's going to put a lot of stress. So you might want to look at changing that, getting a chair that adjusts and can come up a little bit higher.
Can you speak about mouse use?
So mouse use has changed a lot because now we have all these wireless mouses, so you can really put it in any position that you want. The key for mouse use is that it's within reach, so in a reasonable grasp length right here, so you can kind of be looking at your screen, not reaching forward for the mouse and now not being on a good angle to look at your screen, and trying to eliminate the number of clicks, which, sometimes like in the work that I do, using a specific computer program, it's very click-based, but if you could eliminate the number of clicks and just kind of keep things within realm here and not put too much stress on your wrist and relax your hand. If you are, squeezing your mouse really hard and clicking, and there are people and they type and type very hard strike power, you can do a disservice to your wrist and fingers.
I find that the arms to my chair is an impediment to my movement, although the chair otherwise is fine. Is there a good chair without arms, or am I asking for the impossible?
No, there's great chairs without arms. So I have one in my office that's just, it's just like a run-of-the-mill standard office-based chair. It just happens to have no arms, but it has great back support. And that can be really helpful sometimes because if you have to turn and go to lots of different areas and the armrest is in your way or banging into your elbows. Also, sometimes armrests kind of lead to bad behavior just because they're there. People feel like they should lean on them and then they get into a bad position. So just take a look. I don't know the name off the top, and if you had any questions, you could always get in touch with my office and I'll look up for you the names of some of those chairs.
Any guidance on what is an appropriate desk height?
So the desk height it's a little difficult to adjust your desk height for most people. This happens to be an adjustable little temporary workstation, so I could adjust it. It's right now a little bit too tall for me because it's really already at my arm height, so I have to lift my shoulders to get on top of my laptop. So you want to be at a level where it's probably just above your belly button level so that you can reach everything easy, which may be different for you than me. So obviously we don't have as much flexibility with our desks often because they may be already there and what we have at home or what we have in our actual office. And we might have to work a little bit more creatively with our chair setting so that we can fit underneath and get the desk closer, which is what I'm working on in my office now as well.
Is Tylenol or Advil a good relief for back or neck pain?
Oh, so Tylenol and Advil, Tylenol is just is a painkiller. Advil is an actual anti-inflammatory, and it kind of depends on your actual medical situation. So certain people are not able to take Advil because of some of the risks it has for stomach and heart. And Tylenol has some effects on the liver as well that some people need to avoid. Both of them can be effective in reducing pain, and both of them are usually well tolerated. So I would just, depending on what medications you're already on, you need to take a look and maybe discuss with your primary care physician as to which one is safe.
Thoughts on sitting on a ball or stool that moves?
Okay, so this is something I deal with every day because I sit on a stool, as a lot of physicians do, and roll around in the exam room from side to side. So it depends. Like sometimes I come into a room and the stool is too high for me, and the next thing I know, I'm like leaning forward trying to balance. A stool is okay. It again needs to follow the same guidelines I gave before. You want to try to be at a right angle if at all possible, and have your feet actually touching the ground for stability purpose. If you have good core strength, a stool or like the ball kind of seats that people kind of hold their position on can be very helpful. If you don't have good core strength and you're not in great condition, sometimes switching all of a sudden to one of those balancing chairs can be very, very challenging and put a lot of stress on your back. But if you work on your core strength and then you're able to maintain that for a few hours a day, changing position, it can be good to help your core strength. Again, keeping in mind that your feet need to reach the ground in a proper way, and you may need to get some back support throughout the day and not maintain a ball seat for the entire workday. All right, so again, I'm Dr. Danielle Groves with Pascagoula Valley Medical Group, and I hope you got some useful information on office ergonomics today.